good question. Honestly, it's something I haven't poured a great deal of thought into, I will say. I think that it's important. I guess I'm trying to think of what I'd like to answer. Actually, perhaps could I hear the question again? I'm sorry.
Yes.
Sorry, everybody.
Basically, Mount A has no clubs or societies dedicated at the hospital level, and given that students have had problems with the hospital, what would you propose to make student-hospital relationships better?
Well, I think ultimately the first steps that need to be taken are building the relationships with the hospital. I think both the president as representative of the students and as well as the vice president of external affairs as the kind of liaison between those groups that are external to the union and to the university, I believe could open up a dialogue between hospital staff, perhaps work on developing programs or developing some sort of system where students perhaps do feel more welcome at the hospital. I'm not entirely sure of the processes for dealing with incoming student patients at the hospital, but perhaps doing some research on that. Ultimately, opening up that dialogue and kind of encouraging the hospital to think of students as residents of this town as well. I think that's the most important first step that needs to be taken, and I think that would probably be the logical, pursuit to first consider.
I believe that when first dealing with this issue, the ultimate first step is to inform the students of how the hospital works, where it is, what the operation dealing with them, where the health clinic is in relation to the hospital. When I first moved here, I didn't even know where the hospital was. No one told me. I've been there a couple times in my career, and it's been a little uncomfortable every time. And I think ultimately students should just be first and foremost educated a little bit more about the town surrounding the campus, so they're a little more comfortable when that time comes where they have to deal with something like this. My first experience, I had to get an x-ray, and then I had to go to another building, and I didn't even know where that was. They had to give me extensive directions, and I would ultimately have felt much more comfortable had I been a little more informed of this, maybe during Cross Week. Thank you.
So this wasn't anything that I included in my platform. There was a time when there was I don't know exactly what it was called, basically a regional health authority where a lot of stakeholders within the hospital, so you had nurses represented, doctors, you had students represented, a lot of the big stakeholders in the community were represented, and they talked about health issues. That was about 10 years ago. There is still documentation in the SAC office somewhere, probably yellow, old paper falling apart. But it would be great if we get back to that. Of course, at that time it was under the vice president external portfolio. If that was something that the community was looking at getting back involved in, I think it'd be a great thing for the SAC to be involved in. It'd also be great for us to provide lists of doctors, family doctors in Sackville that are available for students, because that is an issue for a lot of people as they come here. They don't have a family doctor, and prescriptions and that sort of stuff is sometimes hard to get. Sorry. Rebuttal, but actually the issue of family doctors in Sackville came up in council, so I guess I'd just like to point out that information is available on Mount A site under health services, so if you need a family doctor, it actually is readily available for you, so in case you need a doctor.
On that same family doctor point, I kind of agree with both of them, but I also think that if a family doctor is indeed available, the students should really know about this first and foremost. If it's just available, it's not really doing much if no one knows about it, and it would just make the experience a lot more comfortable if these things are really taught to the students from day one.
Yeah, there is information out there. There's lots of information out there if you know where to find it. I want students coming to our student union website. When we get this health and dental plan, a plan that I support myself, will vote for, will advocate for, because I think it's important to students here. Within our information on that plan, of course, that's a great spot for us to facilitate all that information about health and dental opportunities. Like, I don't know if you want some opportunities, we're going for that reason, but where these doctors and dentists are in Sackville, and that'd be a really important thing about us moving forward on a health and dental sort of plan. Thank you.
As I said, I guess it doesn't really fall under the portfolio VPM play. But in response to the question, I guess if health services here on campus could be sort of, I don't know, more accessible, more readily available, more out there, sort of people that know what the nurse does and sort of what the health center over there, sort of what it can offer. If that sort of happens, maybe that could sort of release instructions back to the hospital and allow people to use managed services instead of tactile services.
First off, I'll say that this does fall under the Media External Affairs portfolio, and it's a bit unfortunate this is the first time I'm hearing of it. If that person who asked that question is in the crowd, I encourage you to come and talk to me afterwards, and I'll see what I can do for you. But going back to my previous point, I see the SAC as an umbrella organization to help students get involved and using the resources that we have to help students get back to this type of community work. The trend is moving towards engagement. The residents and the officials of this town we have a newfound respect in this town, and my connections with residents, not just town officials, I think would help mend these breaks, and hopefully I can get through that next year.
This is also the first time I've heard of this issue. Now, I will point out that the other day, I don't know if Alyssa is here, but I saw her a couple days ago, and she signed me up for U-Town Mountain. And it was an awesome initiative that you can, yes, you were sitting right next to her, so thank you very much, actually. It was an awesome initiative that links Mount A students with opportunities to get involved in the community. For instance, I think I signed up for one on the site that said hospital, so that was kind of cool. And this kind of thing serves to open dialogue between not only between students and health authorities. The other thing I want to open dialogue between is the hospitals as well as the hospitals and the SAC as well. So yeah, I guess that's certainly something that I'm really open to. And another thing that you learn by connecting with the community, and something that the SAC counselors in particular are very efficient at. So thank you.
U-Town, that Stephen was talking about, is a perfect example of what I'm talking about engagement and how this year has been really, really good for students getting involved in the town. That was initiative started this year. There's several more like it, and hopefully it will continue for the next year.
So going last, I'm actually the person who started U-Town. It's actually great because we're into Family Resource Center, and I think we're on our way to having about 10 volunteers working in the Red Cross, which is based in the hospital. And with that, we're hoping to build up a relationship and kind of use the Red Cross as a reference to also establish some opportunities. Because I was speaking with somebody who works with the fire department, and he says that the hospital is looking for ways to gain access to student volunteers. So right now, that is something that I guess I'm working on, not related to the SAC.